Live now to the Prime Minister in Darwin.
Construction of a new residential care home in Darwin, delivering no less than 120 new residential care beds, addressing acute shortages which are here in the top end. Anika Wells has done an amazing job as our Minister for Aged Care. It's why I promoted her to the Cabinet. The largest reforms in aged care this century, literally. Just one of the big issues that we've addressed in government. When we came to office, there'd been an Aged Care Royal Commission. The interim report was summed up best in the title, neglect. We had a program of dealing with the immediate issues. We've provided a 28% increase in wages of people working in the aged care sector. What the Royal Commission found was that unless we addressed those issues, you simply wouldn't have a workforce. People were leaving the workforce who were dedicated professionals, dedicated to caring for older Australians, giving them the respect and dignity that they need in their later years. But they simply couldn't afford to stay in those jobs, and they were leaving the sector. What we have now is the leaving rates dropping dramatically. We have people coming into the sector. We have 99% of the time there's a nurse back in nursing homes. Something that when we announce that as a policy, when I announced that from opposition, in the days when oppositions had fully costed policies, it was dismissed by the coalition as not being possible. Well, it's real, it's happening right now and making an enormous difference. Everything from that to the work that we've done with Maggie Beer to make sure that aged care residents get more nutritional food. All of these issues have been dealt with. There's more to do, which is why we changed the Aged Care Act last year and delivered it through the Parliament. Our health and aged care plan for the Territory is a comprehensive plan. It's delivering on aged care, but it's doing more as well. $10.1 million to CareFlight to purchase a plane to support medical evacuations from remote communities. Patients in remote NT do not have reliable access to timely emergency medical retrieval services, especially during the wet season, and this will provide care for up to 700 patients a year. We'll deliver an upgraded Medicare mental health centre in Alice Springs and a Headspace Plus and a youth specialist care centre in Darwin. This is on top of the record investment that we've made in Northern Territory hospitals. When we made the announcement earlier this year about the $1.7 billion of additional funding over just 1 year for hospitals, of that, the Northern Territory was the biggest increase per capita. A 30% increase, the largest of any jurisdiction, playing catch-up here in the Northern Territory, making sure that that care is given. We have already delivered the 8 urgent care clinics, and of course, Northern Territorians will also benefit from our tripling of the bulk billing incentive. We want people to be able to see a doctor up to 90% and to just need their Medicare card, not their credit card. We're addressing the catch-up that was needed from bulk billing in freefall from the disastrous time that Peter Dutton was Health Minister, when $50 billion was ripped out of hospitals funding, when they tried to introduce a GP tax and a tax every time people visited an emergency department, and when they couldn't get their way on that, they froze the Medicare rebate for 6 years. And we are determined to make sure that we strengthen Medicare and that we do it right throughout the country, including here in the Territory. The last measure, of course, I'll talk about today is cheaper medicines, making an enormous difference. Bring it down to just $25, the same price that PBS medicines were back in 2004. And, of course, we've frozen the maximum amount to just $7.70 for pensioners and concession card holders for the rest of this decade. So whether it is urgent care clinics, hospital funding, aged care, mental health support, cheaper medicines. We have a comprehensive plan that we're launching here today, and that's why I'm so pleased that we're joined by our Health Minister as well as our Aged Care Minister. And I'd ask Anika's going to make some comments, and then Katy Gallagher is going to make some comments in her capacity as Public Service Minister, and then we're happy to take some questions.
Thank you, PM. Good morning, everyone. It's great to be back here in the NT. Our local journalists will remember I spent some of my formative years here in the NT, including going to preschool at Ida Stanley in Alice Springs. As the Aged Care Minister, it's my 4th trip back here, I think 2 in the last month. And last time I was here, Luke and I went to Pearl Supported Care. And Jan, who runs Pearl Supported Care there, she's been in aged care for more than 2 decades. She told us that she had a wait list of over 100 people waiting for a bed at Pearl Supported Care. So I promised Jan that we'd go away and do some more work and see if we could help her. And today we return with $60 million worth of good news to build 120 new aged care beds here in Darwin. That will be on top of the $40 million we have already invested in building more residential aged care facilities here in Darwin this term. What that process looks like now is we will open EOIs. We have already been talking to providers who have the kind of experience and capability to be able to deliver this facility. We've had significant interest and we'll continue to work through that. It is part of the ambitious agenda that the Albanese government has had for aged care this term. It was the very first bill that we put through the 47th Parliament. We have now invested more than $35 billion in fixing the aged care crisis this term. That looks like $17.7 billion in wage rises for our aged care workers who have long been undervalued and underserviced, and we need those people back in the sector. And like the PM said, because he keeps a close eye on this and I appreciate his support, they are flooding back to the sector. The staffing rates look great now compared to where they were 3 years ago. And despite the fact in question time every single day the opposition asked me how on earth I was going to do it, we have put nurses back into nursing homes. 99% of the time now there is a nurse on site in a residential aged care facility, something they scoffed at the possibility of happening. That's on top of 4.8 million minutes of care that we've added into residential aged care every single day. And I appreciate, shamelessly take this opportunity to thank the Prime Minister and Ministers Butler and Gallagher for their support of me and believing in me and my ability to get this done. Together, we can't wait to keep working for older Australians to lift the standard of care in aged care.
Thanks, Anika. Well, today we've been up here talking about public service and the importance of public services to the people of the Northern Territory and the importance of public servants as a workforce here in the Northern Territory and here in Darwin. There are a pretty large workforce, well over 2,000 public servants across the Northern Territory. And if Peter Dutton has his way with his 20% cut to the public service, that will mean around 500 jobs will go from the Northern Territory. The big employer in the Territory is Services Australia, but also those other frontline service delivery agencies. We know the people in the Northern Territory, because I hear it from Luke and Malarndirri all the time, about the importance of those roles, the importance of having additional help to make sure those services can be provided to the people of the Territory, whether it's getting your pension on time, being able to engage with Centrelink, being able to see a person and have your issue resolved. That's the work that Luke and Malarndirri have been doing up here to make sure that the public service is funded properly and able to do the job that we need it to do. And that is all at risk because we know Peter Dutton has said he will cut 41,000 jobs from the public service. Senator Nampijinpa Price was put in the job of essentially Shadow Minister for Doge not long after Elon Musk was appointed to that position in America. And she was given the job to go out and work out how to make cuts to the public service. She has repeated that 41,000 jobs will go this week. This morning on radio, Senator Patterson has said there will be redundancies in the public service, so this rubbish that it's all going to be found by attrition has been put to bed today. It is actually redundancies, which means sacking of public servants. Now, Senator Nampijinpa Price, her backyard, of course, here, she's refusing to say where those cuts will come from, but we know those cuts are coming. They've been very clear that they're going to cut hundreds of billions of dollars, which they see as waste. That will mean jobs will go, services will go. And then the real kicker is they're not going to tell you when those cuts are going and where they're going from until after the election. So that is what is at risk up here in the Territory, jobs going, services going, and an opposition who's refusing to say where those cuts will be made.